Welcome to today's news on October 14, 2021 on News Channel 24H News, the channel specializing in updating information on the fastest and most accurate information on the situation of the COVID-19 epidemic. Please subscribe to the channel to be updated with new information. The following are the main contents. National record as Victoria reports 2,297 new COVID-19 cases. It is expected to further relax epidemic prevention measures in Sydney. Australia can give a COVID-19 vaccine to children aged 5 to 12 years old. Australia lives with COVID-19. National record as Victoria reports 2,297 new COVID-19 cases, 11 deaths. Victoria reported a daily nationwide record of 2,297 new local coronavirus cases and 11 other deaths, as lockdowns unfold in the Mitchell Shire and authorities identify additional exposure points. COVID-19 in parts of the state. Thursday's case count surpassed the previous Australian state record for daily cases of more than 330 cases, in 1965, reported by Victoria on Saturday, October 9. The number of new cases comes from more than 82,762 tests. At least 37,611 Victorians rolled up their sleeves to receive a COVID-19 vaccine at a state-run clinic on Wednesday. The state currently has 20,505 active coronavirus cases. The Mitchell Shire's ban was lifted at 11:59 p.m. Wednesday, with Health Secretary Martin Foley praising the community for the high vaccination rates there over the past few weeks. Whether it's unlinked cases, community transmission cases, they've all stabilised and the public health team is confident that the outbreak is well understood and Mr. Foley said, is well managed. The lifting of the lockdown brings the Mitchell Shire in line with the rest of regional Victoria. While the restrictions for people to leave their homes and the 15 kilometres travelled limit will no longer apply, people in the area will still have to wear masks indoors. They also cannot travel to Melbourne. Meanwhile, NSW has also recorded 406 locally acquired COVID-19 cases and 6 deaths today. NSW Health says 91.1% of people over 16 have now had a single dose of the COVID-19 vaccine and 76.5% have had 2 doses. A total of 71% of children aged 12 to 15 years received 1 dose and 23.3% received 2 doses. More than 85,000 COVID-19 tests were performed yesterday and 143 people are being treated in intensive care units. Premier Dominic Perrottet said that the state expected to hit its 80% double-dose target by the end of the week. That is due to triggering more restrictions to be eased on Monday. We will have this discussion with our team on Thursday and we will make a decision that will be announced on Friday, he said. It is expected to further relax epidemic prevention measures in Sydney. On the morning of October 13, the New South Wales state government announced that the state may relax more restrictions in the city of Sydney a week earlier than planned on October 18, in the context of the eastern state. The country's largest population is gradually reaching the goal of injecting 2 doses of COVID-19 vaccine for 80% of the population. New South Wales is expected to hit this milestone by the end of the week, earlier than expected. Local officials had previously announced that they would further relax restrictions on vaccinated residents as early as the week after the above vaccination rates were reached. New South Wales Premier Dominic Perrottet told ABC Radio, if the vaccination completion rate reaches 80%, we expect to ease restrictions starting next Monday. The final decision will be announced on Friday. Accordingly, shops, pubs and gyms are allowed to welcome more vaccinated customers. Mandatory wearing of masks at work will be lifted, bars will be allowed to reopen to serve customers on site, and weddings will be held with no limit on the number of guests. The city of more than 5 million people, Sydney, was lifted from its nearly 4-month blockade earlier this week, after meeting its target of 70% vaccination. New South Wales state officials announced that they will gradually relax the remaining restrictions after vaccination rates reach 80% and 90% respectively. The state government has warned that the number of infections will still increase when reopening, but has also dismissed the warnings of some medical experts that hospitals could be overwhelmed as the number of infections increases amid the pandemic. Australia is pursuing a strategy of living with the virus. Australia can give a COVID-19 vaccine to children aged 5 to 12 years old. Australia is starting to consider vaccinating children from 5 to 12 years old, who are not yet eligible for vaccination but have many cases of COVID-19. Accordingly, Australia determines the age of vaccination against COVID-19 based on the proposals of pharmaceutical companies producing vaccines. Currently, of the 3 vaccines being used in Australia's vaccination program, AstraZeneca, Pfizer and Moderna, 2 vaccines, Pfizer and Moderna, are licensed for people 12 years of age and older, and there is no vaccine against COVID-19 yet, licensed for use by persons under 12 years of age. Despite this, efforts to prepare for the implementation of vaccination for children aged 5 to 11 are taking place in Australia. Pharmaceutical company Pfizer said that in the coming days, it will apply for a license to use the COVID-19 vaccine for children aged 5 to 11 years old. In addition, Professor Alan Cheng, co-head of the Australian Immunisation Advisory Group, said that if all goes well, by the end of this year children aged 5 to 11 in this country can be vaccinated. Prevent COVID-19. Although the current level of danger of the COVID-19 epidemic for children of primary school age is low, more protection from vaccines is still better. Although Pfizer has just applied for a license to vaccinate children against COVID-19 for 5 to 11 years old in the US so far, and the pharmaceutical company has not yet applied in Australia, Professor Alan Cheng said that the agency's Australian authorities will take several months to review before granting permits. Australian Health Minister Greg Hunt said that the COVID-19 vaccine for children aged 5 to 11 years old depends on Pfizer's application for a license to use the vaccine for this age group to the Australian authorities. Although it has not been determined when this issue will be decided, Minister Greg Hunt confirmed that Australia now has enough vaccine to give 2 injections to 2.1 million children in this age group. According to statistics from the Australian Department of Health, so far, nearly 83% of people aged 16 and over in the country have received 1 dose of the vaccine, and 63.4% of people have received 2 doses of the vaccine. Australia lives with COVID-19. After nearly 2 years of the outbreak of the COVID-19 pandemic, more and more countries are realizing that it is not possible to completely eliminate the SARS-CoV-2 virus. Therefore, living with COVID-19 is being directed by many countries, typically Australia, a country that has been very successful in preventing the virus from entering from the outside. Change strategy. Melanie McTighe and her 92-year-old father live in the same city, but they haven't been able to see each other for almost 4 months. But this changed on October 11, when Sydney, Australia's largest city and the capital of the state of New South Wales, NSW, was opened after a strict lockdown imposed from June to prevent outbreak of Delta variant. McTighe said she is excited to restart her normal life and see her loved ones again, but she is also worried about how dangerous the city of 5.3 million people is when COVID-19 is still in the community. As such, from 11 October, fully vaccinated Sydney-siders, who make up more than 70% of the city's adults, can return to restaurants, bars and gyms. Many people like McTighe can now reunite with loved ones after months of separation. However, all the freedom that takes a lot of effort to get, still comes with the risk of having to pay the price. There are still many questions about how the health system will deal with any new cases. And how can Sydney adapt to living with COVID-19? What happens next will be very important for the city of Sydney in particular and for Australia in general. Not only that, other countries in the Asia-Pacific region will also be watching closely to see if Sydney can succeed in keeping the number of cases and deaths low enough to avoid putting pressure on diseases hospital, while still allowing businesses and people to continue with their normal lives. Barriers to the reopening plan. Australia had to abandon the zero-COVID strategy that it pursued during most of the pandemic when realizing that it was not possible to completely eliminate COVID-19 but could only live with it. Australia's reopening plan is based on total adult vaccination rates in each state, but vaccination statistics are not evenly spread. In some suburban areas of Sydney, full vaccination rates are as low as 30%, according to government figures. Youth vaccinations are of great concern, but in NSW only 58% of 16 to 29-year-olds are fully immunised, the lowest of any age group. Meanwhile, the age group from 12 to 15 only has access to the vaccine. Ms. McLaws from NSW said young people are likely to be among the first to take advantage of the freedoms afforded by reopening, so ensuring they are fully vaccinated is especially important. Australia's strict border controls will allow it to avoid the chaos seen in other countries in 2020, when COVID-19 cases spilled from hospitals into medical units. Temporary However, despite 18 months of preparation, health groups have warned, the NSW hospital system may not be able to cope with a surge of new infections when it reopens. Shortly after Australian Prime Minister Scott Morrison announced plans to reopen NSW earlier, Omar Khorshid, the head of the Australian Medical Association, urged authorities not to be reckless. Mr. Khorshid said, "The end result of opening too quickly or too soon will be inevitable deaths, and relocking is understandable, something no one in NSW wants to see."